Welcome to the Patient Voice Amplified podcast. I'm Adam Charrington.
And I'm Dan Check.
We're very happy to be together again and talk about how we can help listen more to the voice of the patient in healthcare technology. Dan, I'm excited for our guest today. We've got a great provider that I know cares a lot about listening to patients. It's our friend and colleague, Jeremy Rogers from Indiana University Health. He's the Executive Director of Digital Marketing and Experience. So why don't we welcome Jeremy right into the podcast. Jeremy, how are you?
I'm awesome. How about you?
Doing great. So happy you could join us, and thank you for making time to share your perspective on this. Jeremy, will you please share with us a little bit about your background and how you got to your role today?
Yeah, I'd be happy to, Adam. So I've been at IU Health now for just over 6 years. This is my first role in healthcare. Earlier in my career, my background is in e-commerce, both B2C and B2B. So a lot of experience there. If you'd asked me 7 years ago if I would ever work in healthcare, I probably would have said no. It was never on my radar. But there was an opportunity to join IU Health at the time. The more I looked at it, the more interesting it became for me. I think at that time, organizationally, there was a lot of interest in being more consumer focused and tapping into out of industry experience, a trend you've probably seen with other provider groups around the country. I think it was a great fit. I've really enjoyed it. What I like most about healthcare really is the mission focus. I mean, one of our priorities at IU Health is to help Indiana become a healthier state. We have a lot of work to do there. So that resonates with me quite a bit. And then the fact that I'm learning every single day, even 6 years in, I still consider myself a healthcare neophyte. It's such an interesting, evolving, complex industry. I like that variety. I like that challenge.
That's awesome. Tell our listeners a little bit about what a director of digital marketing and experience does on a typical day. What does that look and feel like?
Yeah, it's a great question. I think a lot of people wonder what marketers do in healthcare and large health systems. I think it's an interesting role. A lot of my work is really focused on the digital touch points a patient has throughout their healthcare experience. If you think about your typical healthcare consumer these days, digital really is more and more at the forefront of how they interact with their providers, and it's really across the entire patient continuum. It's not just when they're in an office or in a hospital. It's how they're choosing which provider they'll see, how they're scheduling appointments, how they're paying a bill. So really a lot of my days are filled with those inflection points in the patient journey, helping make them easier, more consistent, more repeatable, more reliable. On the marketing side, we do a ton of work to help our peers across the system attract, acquire, retain, foster relationships with customers, patients. And that's really, if you look at a large academic health system, we do a lot of different things. So there are lots of needs there. So a lot of variety, a lot of things happening. Very interesting space.
You had mentioned one of the things that drew you to healthcare 6 years ago was you're almost on the forefront of this change towards consumerism and those types of behaviors. What are you most proud of over the last 6 years that you've been able to accomplish over at IU Health?
That's a great question. I think there's a lot to be proud of. I think we have an awesome team. I think me personally, one of my proudest accomplishments has been helping to build and foster and cultivate a very dynamic, strong team, folks who are very focused on the patient. I think in terms of projects, we've accomplished a lot in those 6 years. We've done a lot of modernization, a lot of digitization, a lot of bringing the customer and the patient into the forefront, into the center of all the decisions we make. I think we've made great strides in being a more customer friendly, easier to work with organization. So I could go on and on. We've accomplished a lot, but we have a lot more to do also. And that's what excites me the most, frankly, is looking forward. There's so much opportunity. I'm kind of mid-career myself. I don't know if I'll work in healthcare for 20 more years, but I certainly could. There's still a lot of room to grow.
When you and I spoke not too long ago, we talked a little bit about the PFAC, the Patient Family Advisory Council that you have at IU Health. Can you describe what that is, first of all, and then how you're using that to listen to patients? I was really intrigued with some of the things you're already doing there.
Yeah, I'd be happy to, Adam. So PFACs are a fairly standard approach across the country. We have 16 hospitals and multiple service lines. Almost all of our hospitals have their own patient family advisory councils where they have a small group of patients, current patients, former patients, community members who have really agreed. They've raised their hands to come together occasionally, monthly, quarterly, what have you, and have meetings and talk about, what their experience is like, how they they need improvements, what they're looking for, share some feedback on recent appointments, recent encounters. Oftentimes we have topics we'll bring up to them. So whether it's, almost a focus group type session, we have a problem we're trying to solve or a solution that we're piloting or contemplating, and we want their feedback. Those have been in place for years and years, and they're very, very helpful for us. What we've done in recent years is kind of build upon that. So PFACs are great, but they're only a point in time. It's typically it's more of a qualitative exercise versus quantitative. And so we're trying now to augment that more with other voice of customer channels. So we have lots of different opportunities. I think, Adam, you and I talked about some of our IU Health Insiders, which is almost a virtual PFAC where we have multiple thousands of patients around our system who have opted in to provide that type of feedback in more of a digital environment. So that could be surveys sent via text or email. It could be online focus groups, online message boards. We have folks who've agreed to be secret shoppers. They've agreed to be guest speakers on our behalf. If there's, a partner or a vendor or an industry event we need feedback on, things like that. So we have different channels there. And so, a lot of great work from our team, from our adjacent teams on how we're leveraging those groups in all of our decision making. So I think there's a lot of room to mature there. But we've done great things to really bring the voice of the patient directly into decisions that we make, from the biggest decisions around like new platforms, new business capabilities, all the way down to really small changes. It could be copy we have on a web page. It could be how we position a new clinic, like in a community location, things like that. There's just all sorts of information we can glean from them. And it really is around co-design, bringing the customer into our decision making to help inform early on. That's been a real big transition for us.
That's awesome. Dan, that feels like a megaphone type moment, or you're listening to the patient, and we love that. So that's great to hear. I remember you talking a little bit about how some of the typical demographics didn't always represent your typical patient or even the entire patient base. Will you share with our listeners how you came to that and what you did to address that?
Absolutely, Adam. It's a great point. So we talk about PFACs. You may have a dozen, 15, 20 members of a PFAC. That's not necessarily representative for a large hospital of their overall patient base. So representative, our hospitals, we have urban, suburban, and rural communities that we support. And so it's important that in each of those cases, we are representing the voice of the patient proportionally in those types of avenues. So we've done a lot to segment our patients to understand who they are, where they come from. It's not just demographic, it's psychographic elements too. And what we're trying to get better at is in decision making, are we talking to patients who are at the forefront of that? So it's good to get a general voice, but whenever possible, we want to make sure that is representative of the broader patient population. It's been important to us for a long time. I think especially now with the DE&I efforts across our industry, it's even more important for us. It's challenging too, though, because some of the communities that we support have different types of diversity. It's not just a binary thing, a yes or no. We talk about nationalities, languages spoken. Indiana, you may not expect it, but we have very interesting diversity in things like, obviously lots of Spanish speaking patients. We have a large Burmese population in portions of our state. And so those are examples where when we're listening for voice of customer, we want to make sure that we're drilling that down to the actual customers in that community that will be impacted by these decisions that we make. Does that make sense?
Yeah, it does.
I have a couple of follow-up questions for you. One, I'd love for you to define DE&I for any of our listeners that may not be familiar with that term that's coming up in the industry? And then the second thing I'm curious about is your insider program. Do you find that that's a little bit more representative of your population base in the state, outside of those PFACs? Do you find that to be representative, or do you have to do initiatives beyond even your insiders?
Yeah, great question. Great question. So DE&I, that's diversity, equity, and inclusion, is what the acronym stands for there. And in terms of the question around representation, yes, absolutely. We have found that the insiders group I mentioned does have different types of diversity than some of our PFACs. And that makes sense, though. We're talking thousands of patients versus dozens. So it's all a numbers game at that point. We certainly do run into scenarios, though, where we are still lacking proper representation. So whenever that happens, we try to be very transparent about that. So if it means, for example, if we're doing a survey, let's make sure that our sample size is large enough to account for that. We may have to go back to market and do follow-up, field additional surveys if we need to, but it certainly can be challenging. Like I mentioned, certain pockets of our state, there may be different types of diversity that look different, feel different, sound different. And so we have to be very intentional about that. And we're not perfect there. We certainly have a lot of maturation we have to continue with, but we've made great strides.
That's awesome. It's so interesting, and something I hadn't thought of, that, just because they're willing to give feedback may not be representative of what you need entirely. I want to ask you about something else you've mentioned to us before, patient journey maps. How do you think of that? What does that mean to you, and how have you utilized that at IU Health?
Yep, great question, Adam. So I think journey mapping is not a new technique. It's been around other industries for years and years. In my 6 years in healthcare, I've seen it actually grow in priority and importance and usage. In past lives, we would use journey maps to understand the moments that matter for a customer. When are they making tough decisions? When are they having emotional reactions? And try to focus our solutions on those. Healthcare, I think, is really tricky because if you think about it, there is not one Uber journey map that covers all patients. Healthcare experiences are not monolithic. Different patients have different experiences based upon where they're at in their life, what types of chronic conditions or not they may be dealing with. So we've tried to tailor those journey maps to specific services that we have. We don't do them for all services. Large health systems, you could have catalogs full of journey maps, but we've tried to drill really deep where we can to understand, for those particular journeys that are complex or very, very common, how do we use tools like journey mapping to understand where patients are at in that continuum. Again, like I mentioned, where they're having emotional decisions, where it's impacting their health, their well-being, and what types of approaches, what types of solutions can we deploy or refine to improve the outcomes there. And so we use those techniques, very, very common across the board. So it could be for clinical experience, it could be for some of the digital capabilities my team is deploying. How do we augment things, kind of round out multi-channel solutions, things like that? In the spirit of continuous improvement, how do we keep refining, keep sharpening the tools there to make it better for the patient?
So let's marry these topics that we've been discussing a little bit. How are you leveraging your PFACs and your insiders to determine these journey maps, or to augment and refine those maps? How is this whole ecosystem working together for you?
Yep, great question. So, like I said, it's more of an art than a science. What we're trying to do is be very tactical in how we leverage voice of customer in the decision making. So whether it's a new project that we're kicking off or an enhancement that we're doing, which voice of customer channel is going to be most appropriate to glean that feedback. So an example I'll give you is we go back to our online IU Health Insiders group pretty much annually to get feedback on our patient portal. We've done it consistently to get kind of where we're at with them. And it's been interesting in the pandemic, a patient's perspective of a portal and having that connectivity with their provider is only grown in importance. So we've seen the results of those surveys have changed over time, really regardless of if we haven't changed some of these things, but the feedback from the patient is different based upon their perspective, where they're at in their life. So using data like that to kind of prioritize the work that we're doing, strategic funding that we're seeking out, prioritization of, what could go first, because we have lots of product roadmaps, lots of things that we want to work on. There's tons of opportunity costs. So, we have finite resources, we have finite time, finite bandwidth. How do we use those types of insights to prioritize the work that we're doing to have the biggest bang for our buck? That's typically what we see.
That's an interesting thought. We've definitely seen in our interviews with healthcare provider organizations this shift, especially during the pandemic, of move towards consumerism. But I had never thought of it as almost a moving target for healthcare organizations that's constantly changing and evolving as they have digital experiences inside and outside the industry. It's going to cause a shift in their perception and their expectations.
No doubt about it. I mean, we talk quite a lot about how we're not building statues, like we're building platforms, ecosystems that have to be able to evolve and grow and flex over time, because the expectations our customers have today are not what they had 5 years ago, and they're certainly not what they're going to have 5 years from now. So we have to be able to plan for that and embrace that change.
That's so interesting, and absolutely a good descriptor of healthcare today, isn't it? So, with your background coming outside of healthcare, can you think of examples you've seen where the consumer is brought to the forefront, and maybe are there ways you're trying to incorporate that in everything you're doing today?
Yeah, great question. So definitely, in my past roles, it was really more around getting customers to buy something. What's their average order value? What's their retention rate? Things like that. In healthcare, it's different because we're trying to drive better health outcomes. And so I think we look again at the full patient journey. How do we engage with them at those right moments to nudge them or to remind them or to reach out to them proactively? That's where I see a ton of energy right now, Adam. And I think it's really unique to me because there are technologies, capabilities, data sources that other industries use that we're beginning to tap into to be more intelligent, more specific and precise in how we do engage with patients along the way. That I think is a really unique area. Areas like personalization, especially on the marketing side, personalization in healthcare is still a very, very nascent trend, still very emerging, and we see a lot of really cool stuff happening there. So again, I just get really energized by these trends because there's so much that we could still do. And it, like I said before, opportunity cost. Like, we could fixate on the bright and shiny, but what are the things we want to do to really have the biggest impact, move the needle the most? That's what it all boils down to.
So where do you think healthcare needs to go next? Based on all these perspectives we're talking about, where would you like to see it go and truly focus on the patient more?
Yeah, there's a lot I could answer there. I think some of it's tough right now where we're at with COVID and crystal balls being kind of foggy. But I think overall, if you sort of narrow it down, we need to make it a lot easier for patients to engage with large health system, large provider networks. It's still, the typical patient experience is still way too fragmented, way too unpredictable, way too challenging to navigate. And I think the way we're cobbling together these solutions makes that difficult to solve. But I've seen a lot of action during COVID in terms of creating a more seamless approach, even if think of the duck analogy where it's swimming across the pond and the duck's feet are kicking under the water a lot frantically, but on the top of the water, it's very smooth. You don't see that movement. So I think similar to a patient, we have to do better at kind of disintermediating that complexity away from the patient to help them. And I know that's easier said than done. I don't want to trivialize it. There's a ton of work to be done there. But I think in the end, if you look forward a few years, that will help patients better manage their own health, because we know nowadays patients have to be more in charge of all aspects of their healthcare. We have to do more to make that easier for them. It'll also encourage them to be a more active partner, a more active participant, whether it's wellness, whether it's gaps in care, all of those things, especially for chronic conditions. I think we can have a profound impact on health outcomes by helping in those areas.
That's fascinating. Well, Jeremy, as we wrap up this conversation, I'd love to understand or hear any advice you have for peers in the industry, for those that may be listeners on either the vendor side or the provider organization side. What are one or two key takeaways you would hope they would have from this conversation on how to better focus on the patient and listen to their voice?
Yeah, no, I think it's great. I think a couple of things I mentioned. Number one, you don't have to boil the ocean. I think if you just get guiding principles where you want to weave the voice of the patient into your decision making, you can start small. So you don't have to solve it all day one. So if whether that's a big project on your radar or something small your team is working on, ask your team, have we talked to our customers about this? Do we know what our customers think about it? You may be surprised sometimes people have opinions or beliefs. We have a lot of really smart people in healthcare, a lot of experts, but opinions, everyone has opinions. Until we have the data to prove out what do our actual customers think about this, you may be surprised that what you think about internally may not be the same perspective your customers have. That's number one. So start small and build from there. I think the second theme I would touch on is just you've got to be able to fail fast a little bit. And I think that's tough for some people with healthcare because in many cases you're dealing with lives and health, and you've got to be perfect in most cases. Quality is definitely job number one. But there are aspects of the customer journey where you can do experimentation. You can try small, you can make mistakes. You may not be perfect, but you'll learn from them. And so I think that's one theme I've seen in our industry is especially in more of the business or administrative projects that we have that don't actually involve health, patients' health, there's maybe a hesitancy or not as much appetite to fail fast or learn from mistakes. And I've always been taught that, you can learn from a mistake. It's okay to make a mistake if you're learning from it and you're growing, getting better. So I'd like to see more of that in some of the work that we do.
Great stuff, Jeremy. Thank you so much for your insights. And this is a amazing time to be in healthcare, both for the opportunities and the significant challenges. So from KLAS, we just thank you and your team for what you're doing. We hope we can support and cheer you on in any way we can. And we just appreciate you coming on and guiding us and our listeners today. So thank you so much.
Thanks, guys. Appreciate you having me.
Well, Adam, that was an interesting interview with Jeremy today. It's fun to hear some of the ways that they've tackled PFACs and engaged both a small and a larger group of patients to really put their voice at the forefront.
That really jumped out to me as well, that you have to do more than just listen to patients, but listen to the right patients and get a diverse group. I hadn't considered that before talking to Jeremy, so I really like that.
Yeah. Was there anything that stuck out to you outside of that?
I loved the duck analogy, the feet under the water, vigorously moving. You think of all the energy and effort that goes into that, and then hopefully on the surface it's smoothly moving across the pond. That's going to stick with me. Every time I see a duck, I'm going to think of patients, and are we truly working to try to help them? And there is a lot of energy there. And think about what's probably more realistic today. It's probably an upside down duck. The feet are in the air kicking, and we're trying to get there. But I think that simple analogy just shows what we can strive for. Lots of effort to make it smooth for patients.
Yeah, you could almost take that analogy to a technology perspective, and you want this seamless, easy experience on top of the water for the patients, but behind the scenes, the organization may be paddling those feet with a lot of different technologies cobbled together to create that unified experience. Ultimately, providers want a seamless experience, the patients want a seamless experience, but if you have to sacrifice one for the other, certainly we would hope that the patients are the ones with the smooth experience.
We hope so. Yeah, that was great. Appreciate Jeremy coming on again. Dan, I'd love to take a moment and talk about what are we hearing in some of our research. I've got something I wanted to share with you, if I may.
Yeah.
I talked to a provider not long ago that used the term patient access. And this is an interesting term because, as you know, at KLAS, that's a category we rate, and it's about insurance eligibility and verification. But this provider was using it a little bit differently. Very patient-centric description of what that means. And I'll just share what they told me. They said, patient access means more in terms of front door, like digital front door we've talked about many times. It means getting patients in, making the experience easier. Things like referral management, scheduling templates, and standardization of scheduling templates. All the way through things like appointment reminders, bi-directional messaging. You think of all those pieces, and it kind of relates to today's conversation, making it smoother for patients. There's so many unique technologies. It just came up in a meeting today. A vendor was asking about how often are people really gravitating towards those bleeding edge things. And we hear a lot about those. We'll see those when HIMSS comes up here in a few months. But you think about where patients want to be, help me get things scheduled, help me communicate. So I wanted to share that one with our listeners today. Just overall making the experience easier. I think that speaks to what we try to learn and share here on the podcast. Would love to hear from you. I know we're vigorously working on several KLAS reports. What's something you're learning in our recent research?
Yeah, I thought I'd share one thing. This actually ties into what we were talking about with Jeremy a little bit. The need to hear the patient voice and to identify demographic and psychographic trends and things that pertain to your patient base. As you know, we're in the middle of a study right now measuring the patient voice, and we've gathered just shy of 13,000 patient responses. And I just wanted to share one small nugget from that I found interesting, and this may or may not make it into the final version of that report, but one of the pieces of demographic information we asked about was education level, and I found it really interesting. There's somewhat of a correlation between the technology adoption and the education level. Those that have some grade school experience, some high school, but not a high school diploma, even up to having a high school diploma, are some of the ones that we see the least amount of technology adoption and comfort level with. But there's almost this point of as respondents with higher education levels shared, they almost pick and choose the technology that they interact with. And I don't know if that has to do with different types of jobs that they have or different life experiences, but once you hit graduate, postgraduate degrees, even bachelor's degrees in education experience, they start to look for things like scheduling convenience, that as schedules are busy, they want to be able to schedule an appointment at a late hour. I don't know that there's anything that you wouldn't expect with a finding like that, but it certainly is interesting that it plays out in the data that we've gone and collected. That's
really interesting. This is one of the first times we've gone that granular on demographics and such from our respondents, especially from the patient's perspective. So I appreciate you sharing that. I know that's coming out very soon. We're excited to share that with provider and vendor friends out there. And certainly we're getting a lot of questions about that. How do you listen to patients generally and then get more specific with them as well? So thanks for sharing that one. Well, that sounds like a good place to wrap up for today. We want to thank our guest, Jeremy Rogers from IU Health again. And Dan, I've got to share my quote of the day, right?
Yeah.
We have this episode. Given the duck analogy, we have a duck quote to share. Always behave like a duck, keep calm and unruffled on the surface, but paddle like the devil underneath. Jacob Browd said that. Jacob, we don't know you, but thank you for a great quote that relates to today's episode. We also want to thank our classmates for all their effort to gather research that hopefully impacts the market and helps our provider friends and vendor partners out there. I want to thank Jeff Peterson, always taking good care of us and making these podcasts possible. And Dan, as always, it's great to be with you and look forward to the next one.
Likewise. Thanks, Adam.
Thanks.